Hi, this is Bob Sheehan. I'm the CEO of the Community Mental Health Association of Michigan. I'm part of the Great Lakes Mental Health Technology Transfer Center, an initiative we've engaged on region-wide in the 6 states around the Great Lakes region to interview social workers in our region and give folks a sense who aren't social workers what the work is like. Today, I'm interviewing Lori Eldred, a social worker in Michigan. And Lori, if you could introduce yourself, and then I'll ask you a series of questions.
Hi, my name is Lori Eldred. I'm a social worker here in Michigan. I've been practicing it'll be 20 years this year that I've been in the field. I'm currently in private practice where I work specifically with other social workers and mental health professionals and use a bunch of treatment modalities, EMDR, IFS, polyvagal, to really help address not only just primary trauma with social workers, but secondary trauma as well, and hopefully to prevent additional secondary trauma. I'm also doing supervision with new social workers, newly licensed social workers. I teach as an adjunct, and outside of that, try to enjoy time with my family and friends and get outside on occasion.
It's quite an array, Lori, of duties. What did you do over the course of your career? Did you do other work before private practice?
Yes, I did. I initially started at the CMH level. So I've been both at an urban and rural CMH. And I would say that's probably a big chunk of my time was working at the CMH. Been a supports coordinator, case manager, done crisis, dual diagnosis. I did time with mental health court, jail diversion program. And I've supervised a program, grant-funded program. That was my last position at CMH in Kent County. And I've also worked in the prison system and in child protective services, as well as substance use. And I did a little bit of time. Time is, I don't know if that's the best word, but a little bit in a hospital as a medical social worker.
What a range of functions. Pretty impressive. You sure 20 years? You hasn't been 200 years, Lori, when you talk about that range of duties?
I feel like 20 years is probably more like 40 and kind of.
And dog years, right?
Yeah.
Exactly. What can you talk about like a typical day or week in your current work?
Yeah. So, luckily in private practice, you do have a lot more flexibility. So I have now just scheduled my work week is typically seeing clients the first like 3-4 days of the week. And that's therapy clients. And then I have time and space then to do supervision clients, as well as if I am teaching, to have time either for class or class preparation. And so I would say one of the benefits of being in social work is there is such a variety of things that you can do, as well as working in a more formal agency or organization, as well as, running your own business, being a contract worker, being in private practice where you can set the schedule that might work based on family needs or personal needs or other things.
Yeah, it really is an amazingly flexible profession. Can you talk about, pick one of your public sector jobs over the last 20 years. Talk about a typical week or day in one of those.
I would say if I looked at just when I worked in mental health, the CMH level, in some ways, it felt more like a 9 to 5 or kind of 8 to 4 position. Now, within that was a lot of variety depending on what the position was. So, in case management, often perhaps you'd have kind of a series of clients that you're seeing, but also knowing within that was a lot of flexibility if there was crisis work that needed to happen, or even if you're meeting with a client who wasn't doing well, if then there were certain interventions or assistance that client needed to be safe, including just a higher level of care. So while the day might be more structured, or at least in your planner, it looked very structured, that wasn't always the case. There also were opportunities to do on-call. Sometimes you had to work late, just if there was a crisis or something happening with a client towards the end of the day, that maybe there needed to be some stabilization before passing them off to an on-call, or at least collaborating with on-call. So in some aspects, social work can be kind of more traditional, but in a lot of aspects, not so much. I mean, you could go weeks having a pretty ordinary work day, but then there'll be weeks when it's not ordinary and you're doing a lot of different things, or your schedule's very much changing and moving around.
Did you find that variety or lack of routine exciting? How did you find it?
I think, that's a great question. I think, in some ways it was nice to just have some of the flexibility, right? Often too, if it's a Monday through Friday position and you're working more of a 9 to 5, right? If you're working over, you can always flex out. I mean, so there was flexibility there. I mean, you just really learn to work with a whole variety of different people. So it helped develop a pretty wide and deep skill set. Sometimes it was nice to have a more predictable schedule. Sometimes it was nice to have the flexibility. Sometimes it was nice, in some ways, for your day not to be kind of similar to the days before. I think at times it really allows you to get to know folks and, really see people in different situations and struggling and being a support for them, when often a lot of the clients that I worked with didn't have a tremendous support system, for a variety of different dynamics. But I think there are definitely times when I was like, I liked when it was really routine, and other times where I was like, well, it could be, although you never really wished for it, because if you said, oh, I would love for this to be a different, it would always kind of come back. Maybe a bite in the butt. But I mean, I really see, it definitely allowed for a lot of variety. If you are a person that likes variety, likes that flexibility, likes, kind of things to not be the same every day, I think social work could be that position. Or
yeah, it's a great way to put it. Yeah, it really is. What do you see as the aim or purpose of the work you've done in all of those settings? Is there any kind of a common theme through all those?
I think when I look back, just what I see is really working with folks kind of at the outside of society, of our community, folks that are more marginalized. I mean, often when I was in child protective services, poverty was such a huge influence. Parents loved their children, but often they didn't have resources or supports. We don't have in my opinion, we don't have a super strong social safety net in our country, especially for parents, especially navigating the dynamics of being a parent, having multiple children, having to work, take care of them. And so I think being able to help guide people through the system as best I could was often what I was doing with folks in child protective services, CMH, because CMH is our social, our mental health safety net, even in the criminal justice system, of trying to help folks and just really navigate the system and really just to be there with them. I think also to advocate and use some of the privilege I have to help people get what they needed, or at least to feel heard and what they were experiencing.
It's a great way to frame it. Thank you. Mm-hmm. You alluded to it a little bit, but what was your education to get you into social work? And you talked about your experience, but if you could focus on what kind of education did you have to do the jobs you do?
So for me right now, I have to have a master's in social work and I have to be licensed. The state of Michigan requires that. That is not, I will say, it's not where I started with my bachelor's. I started there in the science field and wanting to go to medical school, and then took a bit of a different path after I started meeting professors and getting more involved in social experiences and social dynamics. And so when I left at my bachelor's, I had landed my first job at the Urban League and was exposed to just a whole variety of things that people struggle with. And from there decided that I had wanted to go back for my master's in social work just to make a greater impact. I think to have the ability, the skills, the training to just make a bigger difference for folks. But yeah, you have to be licensed. So that's a process in and of itself of not only, do you get your master's degree, but you also have to continue to have supervision, continue with training and other support in order to, I think, see that process really to the end.
Yeah. Quite a process too. And you talked about the urban league experience. I think a lot of social workers, either as kids or young adults or as even older adults, have that like epiphany moment. It's not quite a moment, but it can be a series of moments where they start to realize, I think working with the folks that I'm about to work with is what I want to do. And it sounds like you had that experience. Oh yeah. So could you talk more about that? What triggers the line of work? It sounds like started in the hard sciences and medical school thinking, and then you moved towards it. Was it working with the disenfranchised? Was there something that, in addition to that, that drew you, or more about that drew you to it?
Yeah, well, in total transparency, my first semester doing biology and chemistry did not go as well as I anticipated it to go. And so I've always had a passion for the law and had contemplated going to law school. And so got connected into political science and another field of science, but the social science. I think really when you have the opportunity to look at systems, delve in and understand, how oppression, perpetuates itself, how folks are classified, how people have access for different reasons, to resources or to not, I think really just started me on that journey of, how can I advocate within the political system? I mean, that's a lot of what, political science, at least for me, was about. And so being able to continue to do that. I mean, I also grew up in a family, my mother was a single parent. And so I think that some of that dynamic also impacted just understanding at not only just a professional level, but a personal level, like how hard poverty can be, how hard a socioeconomic class can be, how much having resources and access and knowledge, how important that can be for folks, just even being one human to another and being able to help based on what I understand, based on what I've learned, based on what kind of I know. And I think, there were definitely moments along the way where, I was in the field and I'm like, okay, this is why I'm here. This is why I'm here. It really helped, I think, in some days, in some ways when things were harder to keep me going.
Yeah, it sounds like your motivation is pretty deep. Pretty deep, very deep. Yeah, it keeps you going day to day, it sounds like. I'm going to kind of draw us back to a different topic. Do you have a sense of the demand for social workers now, either in mental health or other fields? Do you have a sense of that?
Yeah, I do. I'm part of a workplace conditions through NASW Michigan. And so this is something we definitely talk about. I know that the demand is pretty great right now for social workers for a variety of different reasons. I think there is growing disparity in between groups. I think that there are more and more people who struggle for basic needs and access to resources. Social work also is just becoming, I think it is very common to work often with a social worker, to have a social worker that you might know or at the place that you might work at. I mean, we see social workers now in the corporate field, Fortune 500s and wellness programs. We see, social workers in police departments, at schools. I mean, we see social workers in so many more aspects. I think it's gotten very common to have a social worker in some capacity. We even have social workers in libraries, and there's just such cool synergy between social work and almost any other sector of our community. Social workers often are very well connected. They have resources. They know people. Even if you're graduating from a large program, you tend to know the people that you graduate with, and you tend to work with them. I know in the area where I live and work, there is a big demand for social work at agency level, at organizational level, even at, the higher, what we would call a macro level. So nonprofit work in the legislature. Michigan has, I think, 3 or 4 legislators that are social workers, and they absolutely use their social work skills, I think, to inform their decision making. when understanding their communities. So I think it's gotten very common. And I think because of that, there is a greater demand in getting social work into all aspects of our community.
I think you're exactly right. I'm glad you talked about the breadth of populations and scenes and locations and types of work that social workers can do. I think sometimes when people hear about social work, they know the social worker that they may have worked with or been with or know, and it's narrow in what they think they do. When they hear about the breadth that you just described, I think folks are impressed. And I think it broadens the career opportunities for people who think about social work. My last question is, in terms of your professional path, was there any, loan forgiveness or stipend payment that you found helpful, either getting you into social work or keeping you?
Yeah. So when I started social work 20 years ago, so 2004, we did not have any loan forgiveness or paid internships. I know that came, I think, towards the end of my master's program. So like 2007, 2008. So now, probably more than ever, there's public service loan forgiveness, not just at the federal government, but there's other programs I know locally that I believe pull down federal dollars. But if you're working at a rural or underserved population, there are loan forgiveness programs through those positions. And Michigan is also working on having paid internships. Having funds allocated that as a student you can apply to get reimbursed, because that's absolutely a struggle lots of us have had when you're having to do an internship. Many of us also have to work on top of that, just either being parents or needing to take care of ourselves financially. So I know NASW Michigan is working to make sure that, those internships, that there is financial support with some of those internships. So that's been a nice evolution in the field, is having some of those opportunities, because we also know like that can be a barrier. Finances can be a barrier for students as much as it can be for folks that aren't students. And so I know that supervising some of the newly licensed clinicians, that is something that they've been aware of and have actively sought out if they could.
That's great. I mean, I think you're right. I think we've all wised up to that. Haven't we realized that financial underpinning is pretty key? Lori, any final comments you want to make to folks who might be thinking about social work or who have never thought about it, might find it useful from you?
I think my final thoughts would be that, the field is growing and evolving. There are so many ways that we can advocate and make a difference in our community. I think now more than ever, we need those folks who want to make our systems better, who want, to see folks that are struggling or marginalized, see them and their voices be counted and part of the larger community narrative. It, really calls, I think, as a social worker, on your skills of compassion and empathy. And I think those are very important. I would say definitely, if you're interested in social work, talk to different people doing different positions and roles in social work, because I think there has been for a long time just this really narrow focus that it's just child welfare. And it really has expanded to encompass so many aspects of our community. Like I said, you can be in a library as a social worker, at a school, in the criminal justice system. You can be in the medical field. You can even work at a corporate 500, company that's, lots of companies will hire folks to be therapists, to do wellness programs, prevent burnout, address health issues. And so definitely do your research, talk to different people in the field, and really just see if the profession will be in a good alignment with your values, your ethics, and really your unique strengths.
What a great way to put it, Lori. Thanks a ton. I can't thank you enough. I think on behalf of all the folks in the Great Lakes region and anybody who might watch this video, they've walked away with an awful lot of positive things and really powerful things about what social work's about. Lori Eldred, I want to thank you an awful lot for doing this. Thank you.
Thank you.